Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and help you engage with public policy in the great state of Texas. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and I know the holidays are coming. And on behalf of the entire Texas Impact team, we hope you have a meaningful holiday season and that you're able to connect with family and loved ones and find some joy and peace during this season. But the Texas Legislature comes back to town January 14th, so we also hope you spend some time in the next few weeks mentally preparing for what's to come. So soak in all of the joy and peace you can now, and hopefully those vibes continue into the next year as we work together for justice and equity in Texas. So to help us prepare for the legislature coming, we're joined today by Diana Forrester, Director of Health Policy for Texans Care for Children, and her colleague, Senior Policy Associate Alec Mendoza. They're going to talk to us about health policy in Texas. And y'all, this is an issue that isn't getting a ton of attention in the press, but will definitely have an impact on people in our families and for sure in our congregations and communities. We're going to talk with Diana and Alec about some possibilities. And y'all, some of you might not believe me, but there will be opportunities to make substantive progress to make life better for Texans. But we're also going to talk about the work that needs to be done to keep what we currently have. We know there will be efforts to make life harder for working Texas families, and we know Texans of faith will be prepared to stand up for the common good this session. I know you're going to be ready. As always, Texas Impact has tools for you to stay up to date on what's happening in the Texas Capitol and get involved in effective advocacy. We'll have our rapid response team up and running, we have our issue champions that have been meeting, and we plan on bringing back the weekly Inside Baseball Zoom check-ins. Learn more about all of the opportunities to get involved at texasimpact.org or shoot me an email at scott@texasimpact.org. And now's a perfect time to give because Giving Tuesday kicked off Texas Impact's annual membership drive. Member support helps us create programming and respond to public policy opportunities and threats. Your membership commitment strengthens our network and demonstrates your values as a faithful Texan. It's clear there are significant challenges coming in the legislative session, as well as important opportunities to strengthen the ways we keep Texas kids healthy, keep families thriving during tough times, and keep the lights on over all of our state. If you're not a member of Texas Impact, I ask you to consider joining us today. Your membership allows us to equip and mobilize Texans of faith in their communities and at the Capitol. Y'all, there's going to be a lot of work to do, and we look forward to working with you throughout the session. But for now, I hope you enjoyed today's conversation with Diana Forrester and Alec Mendoza. Joining us for today's conversation is Diana Forrester, Director of Health Policy for Texans Care for Children, and her colleague, Alec Mendoza, Senior Policy Associate, again with Texans Care. Diana, Alec, thank you so much for joining us today. I know it's a busy time of year.
It sure is, but we're happy to be here.
Yeah, thank you for having us.
First of all, I feel like I have to ask everybody these days. The holidays are coming, but so is the legislature. How are y'all feeling? Are you ready for what's coming?
If somebody has a magic 8-ball, please let me know. I think everybody is just trying to guess what's going to happen.
Yeah, my response to that would be, can anyone ever be ready for a legislative session? I think that's kind of a good default answer.
Yeah, I don't think I'm there yet, but maybe after the holidays, we'll all just feel so inspired and ready. But as we mentioned, the legislature is coming very soon, January 14th, so about a month from now. And I don't think most of the media coverage has focused on, at least has focused a lot on health and healthcare and healthy families. But there are a lot of important issues on the table at the state capitol. What do y'all think Texans should be paying attention to? I want to start. Let's start with the good news first. What are some areas where you think we can make some progress and improve health outcomes and improve Texans' lives? What are we feeling good about going into the session?
Well, Scott, I will tell you, we have a very interesting opportunity before us, I think, this session. The agency that operates, Medicaid and SNAP for the state of Texas, the Health and Human Services Commission, they actually included in their exceptional items this year, requesting additional money to upgrade the technology infrastructure for TIERS, which is an acronym. It's the Texas Integrated Eligibility and Renewal System. But this is something that advocates and stakeholders have been shouting about for almost 2 decades now. And the fact that the agency put to, pen to paper and expressed this desire. And not only that, but they are asking for like $400 million. So it's a substantial ask. I mean, this is historic. They've never admitted that it was a problem before, and they've definitely never asked for help with it. So I think this is a really unique opportunity, and it could have a huge impact on Texas. Medicaid in Texas really only covers children and pregnant women. And it's like almost 3 million kids in our state that are on Medicaid. So if we could change the system through which they have to interact with the agency to really upgrade it and streamline it, it's going to remove a lot of the barriers that exist today for families trying to just get their kids connected to health insurance.
So what's that look like if they make that investment? You talked about it would make it easier, would streamline processes, make it easier. But what's that look like day to day for like a family here in Texas?
Yeah. So if you have ever interacted with tiers or helped somebody try to apply for benefits or do their renewal through it, you will know that it's very glitchy. It makes a lot of mistakes. It's hard to get accurate information through your applicate. If you do have the yourtexasbenefits.com. The app or the website. The state sends notices on kind of like every decision within the eligibility system. And so you'll get like a stack of notices, and they all kind of say something different, and they might even contradict each other. So it just creates a ton of confusion for families. And additionally, the only way for them to really get clarity on like what is happening with their case is to call 211 and talk to an eligibility worker. But there's often long wait times, and sometimes the eligibility worker's new and they don't really know how to give you accurate information. So it's just this really confusing system for families. Additionally, we have had a backlog of applications with HHSC of over 200,000 applications that have just been sitting there that they cannot process in a timely manner. So what does that mean for families? It means you filled out that 40-page application for your kid. You are waiting 3 to 4 months to hear anything. And usually people aren't applying when their kids are healthy. It's like because the school nurse called and said, hey, I think he has asthma. We need to get him an inhaler. Or her vision's not really working. We need to get her to see somebody to get some glasses. Like that's when parents are thinking about, okay, I need to figure out what is available for us for health insurance. So it means those kids are not getting treatment. They're not getting better. And hopefully they're still going to school, but they're not thriving the way that they could.
Love that. Sounds like that would make a definite difference. You also work on maternal health, and that's been in focus over the course of the last couple of sessions, made some really great progress 2 years ago. Any opportunities to make some more headway on that issue?
You know what, Scott? We didn't solve it yet. There's still a maternal health crisis in Texas. We made a lot of movement last session. I mean, it was historic, the amount of investment the legislature put into maternal health for really the first time in a long time. And it was a great first step. And I would love to see continued momentum on that. There's a lot of unknowns with the speaker race in the House, but I do think in general, the House is more unified in wanting to ensure that families are, uplifted and able to function in Texas. And so I'm hopeful that we'll see some movement there. One of the investments last session was for these mobile health units, and the legislature invested $10 million in that last session. And the agency is actually asking for another 10 million so they can do 3 more. But I've been able to go to some of these, ribbon cuttings and talk to the people that are working in these mobile health units. And they're going to areas of Texas where it's so rural and they haven't had access to healthcare in years. I mean, one lady had an IUD and she's had it for 12 years and she just wasn't able to get it removed because she didn't have health insurance. And they were able to do it in the mobile health unit. So I think there are some good things happening in the state, and I do think that there is unified momentum around kind of a few of those things. Like people see the benefit and they want to keep it going. So I am excited about that.
All right, Alec, same question. What are you excited about? What opportunities do we have to move the ball forward?
Yeah, I think there's a lot of things that we can do around children's health in particular here in the state of Texas. as many of people probably have heard or know, that Texas has the worst children's uninsured rate in the nation at 11.9%, and that is more than twice the national average. And what we see is that this is not just a problem that is like congregated in one area of the state. It is spread throughout the entire state. We have 12 metro areas that have an uninsured rate over 10%, and it's in Abilene, it's in Beaumont, it's in Brownsville, Midland, Sherman, Waco, McAllen, Houston. This is a statewide problem that needs statewide solutions. And the legislature does have an opportunity to act, and that's something that we're super excited about. There has been bipartisan support on one particular issue when we talk about children's health, and that is getting eligible kids enrolled into coverage. The state has about 400,000 kids who are eligible for Medicaid or CHIP coverage, but are not currently enrolled. And Medicaid is really important to even rural communities here in the state of Texas. Almost half of children in small towns and rural areas in Texas are enrolled in Medicaid. And so this is something that we're seeing all around the state that we really want to try to work on. And there is that bipartisan support, as I mentioned. There are a couple of bills, one in particular was filed last session by Representative Busey. Then it was House Bill 1599. And this bipartisan support, again, showed in bills like that. It had joint authors with Chairman Oliverson, Chairman Bonin, Chairman Harless, and Chairman Jatan. And this bill got over 100 votes in the House, and it would really focus on that eligible but uninsured population. That bill is coming back. It has been filed both in the House and the Senate. The House bill is 321 and the Senate bill is 238. And we're hoping to bring this same bipartisan support for this current issue over and try to get those bills across the finish line.
And so I assume for all the issues that we just talked about, we're going to talk at the end of this program about what folks can do. But I assume getting those bill numbers, having those conversations with legislators over the course of the next month is a homework assignment, right?
Yes.
Perfect. All right. I will have some folks who will give me mess about starting with the good news and optimism and all of that, because I know we have some folks who are listening who are maybe less optimistic about the legislature coming back to town. So also want to talk about some concerns, some worries that you all have. Diana, starting with you, what are you worried about this session? What should people be paying attention to that might do harm?
Yeah, I think it kind of falls into two buckets for me. So one is really specific in maternal health. We have seen the press has done a lot of coverage on women that have died because of how the abortion ban language is in law and how the hospitals and doctors are interpreting that, and that they cannot terminate a pregnancy until it's like a life or death situation. And so it's putting these women in very dangerous situations, and it's putting our healthcare workers in situations that they don't feel good about ethically, that they're able to do what's best for their patient. And so I think there's an opportunity this session for the legislature to really provide some clarity on that language and saying like, hey, we absolutely value the life of the baby, but also we value the life of the mom, and just providing some clarification on what that looks like. Like, it's okay in the event of, the baby's not going to make it, but we need to save that mom's life. Like it's a scenario that comes up a lot. And I think a little bit of clarification would really help our physicians all around the state feeling better about being able to do what's best for their patient. And then the other thing I would say is, there's a lot of potential now with this new president coming in the new year, for Medicaid to be, I want to say on the chopping block, but like targeted as maybe something that they put more restrictions on. And I think it's imperative to think of it in the context of like the Medicaid program that we operate in Texas is one of the strictest in the nation already. We don't cover able-bodied working adults. It's only kids with disabilities, and women while they're pregnant, and some adults with disabilities. I mean, it is the bare bones program already. And so I think that there's a lot of talk out there about like trying to make the restrictions for Medicaid more stringent and trying to, ensure that it's only for the people that really deserve it. And I would say that we're already there in Texas. We've been there for a long time. And so I am a little bit worried about just kind of what could come out of that mindset, I guess. Yeah.
Yeah. All right, Alex, same question. What are you concerned about?
Yeah, I think, echo everything Diana said, but also it's about really battling a lot of misconceptions, I think, when we talk about Medicaid here in the state of Texas. There were interim charges in the Senate over really focusing on health coverage options for Texans. And it's really hard to talk about health coverage in the state for kids without including Medicaid. As Diana said, a majority of our Medicaid enrollment right now is kids. And so it's really about battling a lot of misconceptions. I think oftentimes we hear, families can get insurance through their employers for their children. That's not always the case. If, a lot of times these employers don't offer that opportunity for families to enroll their children onto their program, or oftentimes those jobs don't pay enough to be able to get those kids enrolled in their employer-based health coverage. And so Medicaid really becomes that option. Dana kind of mentioned it right here as well. When we, talk about Medicaid, I think people often automatically go to Medicaid expansion, and that's for adults. And we're talking about kids right now. So I think it's battling some misconceptions, letting people know that like Medicaid coverage is an option, not only out there for kids who are eligible but unenrolled, but already cover a lot of kids around the entire state. As I mentioned that point, 47% of kids in rural America, in rural Texas, in small towns are enrolled into Medicaid. And so when we talk about health coverage, especially for kids, it's really hard to have that conversation without talking about Medicaid. And so it's really battling those misconceptions at the legislature. We feel is definitely a tall task.
One of the things we've been talking to our members about, I was going to say for the last few months, but really like forever, is the importance of building relationships with legislators in the local district. We are about a month out from the legislative session convening. What advice would y'all have for folks as they prepare for the session and maybe for the first few weeks of session? What do you wish they'd be doing right now?
Well, I think knowing who your representatives are is huge, figuring out who represents you in the House and the Senate. And then also giving them a call even before session starts and saying, hey, my church group is really passionate about making sure families have health coverage or whatever that issue is that is really important to you. I think they need to hear from their constituents what you care about and that you're going to be watching what they do this next session on that topic.
Yeah, I agree with that 100%, making sure that you're really reaching out to those folks. I will say too, I think a lot of times people get discouraged if they're not able to talk to the representative or the senator themselves. I'm a former staffer in the Senate, and so I know full well that, when you are talking to staff, you're really talking to the member. And so even having those conversations, don't be discouraged if you're not able to talk to, the member themselves, but having those conversations with the staff, reiterating a lot of the things Diana said, like, we want to see this in our community. This is an issue in our community, and we will be watching, the member and how they vote, how they talk about the issue, that we're bringing up to you, I think is equally important. So definitely don't get discouraged if you're not able to talk to the member themselves, because a lot of times those staffers have the ear of the member.
Yeah, and there are going to be a lot of opportunities to come to Austin. There are going to be action alerts and rapid response notifications and all of those things during the session. But now is the perfect time to start to build that relationship and let your representatives know that you care, that you're paying attention, and that you'll be calling again soon. So good word there. I would love if y'all would come back on next week because we didn't get to some of the federal stuff. So I'd love to talk more about that if we can figure out a time to do that for next week. But for now, any shameless plugs, any homework assignments, closing thoughts you want to leave with folks?
I mean, I think for the state legislature next session, it's going to be pretty messy as far as just like the fighting within the House and then the House with the Senate. So we are hopeful that they have to pass something, right? They have to pass some bills. And we're just hoping that some of those bills are good bills. And I would just say, yeah, I know that you get overwhelmed kind of by those action alerts. And then it's like, send an email or make a phone call. And then you don't always hear what happened with that. But I continue to emphasize like all of those really do matter. Like I remember as a staffer we would have to keep track of every one of those phone calls and emails. And they would ask like, how many have I gotten on this topic? How many have I, and they do ask before they do a vote. So it does matter. It might feel small. It might not feel important, but I would just really emphasize like, it's okay to do those things and please do them.
Yeah, I will shamelessly plug a couple of pieces of legislation that we're working on. Like I said, House Bill 321 with Representative Busey, as well as Senate Bill 238 with Senator Johnson. This is a bill that will notify parents about their children's eligibility for Medicaid or CHIP when reviewing their application for SNAP. We often see families are really, as Diane had mentioned before, focused on getting food on the table and really, put health kind of in the backseat until there's an emergency. And this is a bill that really catches that at the front end and lets parents be empowered with making a decision that's best for them and their kid. So definitely plugging in those pieces of legislation to watch out for and to mobilize around. But as Diana said, a lot of this, the legislature meets every 2 years and things need to get done and things have to get done. And a lot of these members have to go back to their communities and answer questions about what happened at the legislature. And so talking to them, building those relationships, but, showing up, I think is really a big part of this process because they are, representing you all. They are representing their constituents in their district. And so those conversations, the things you bring up matter. And so it's important to continue to talk to them about the things that you care about.
Yeah, and the impact is incredible. 400,000 kids being eligible but not enrolled. Can y'all imagine what a difference that would make if there were 400,000 more kids in Texas who had coverage? Anyway, I really appreciate you both taking the time and for working on behalf of Texans. Y'all are incredible assets to the state of Texas, and we're grateful both for you and the time. So thanks again, and we'll hopefully talk again soon.
Yeah, thank you so much.
Thanks, Scott.
I hope you enjoyed this week's conversation with Diana and Alec, and I hope you're preparing for the hard work we'll have to do to both expand and protect healthcare for Texas families. If this is the kind of work that's exciting for you, I have a deal for you. Texas Impact has ways that you can get involved. Check out texasimpact.org and click on the Action Center to find out how you can get involved. As always, you can shoot me an email at scott@texasimpact.org if you have questions. While you're there, I hope you'll take a moment to sign up to be a member of Texas Impact. Your membership supports this podcast and all of the work to engage Texans of faith to advocate for a more just and equitable Texas. As we prepare to close, we'll have one more episode next week as we welcome Diana back to talk about health policy at the federal level, and then we'll take some time away from the program to enjoy the holidays. I hope you get a chance to do the same, and we wish you all a wonderful holiday season full of rest and relaxation, as we hope you all find meaning during this season. So with that, I think it's time to close out this episode. So remember, the world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnet, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.